anything here. Awesome. Got Mr. Ori Berkman. Awesome. So Ori, thanks, man. I think you're still muted, so you can unmute yourself. Thanks. You guys got better beards than me. Look at that. You show up. I think you guys still might be muted there.
Can you hear me now?
Yep, we're good. Awesome. So tell us first. I always like, this is really the virtual meet and greet, and people are people first. So who are you? And what do you do for your dental practice?
So we are the practice owner, brother duo out in Philadelphia, city of brotherly love.
Yeah, right near us.
We got Dr. Beckerman over here.
Morning, guys.
I'm his younger brother. I in charge of operations for 4 offices across the Philadelphia area.
Awesome.
We are looking to hire multiple associates for the summer.
Awesome. So great start, guys. Thanks. I love your guys' background. So you're right near me in Philadelphia. Where is important? Okay. Where are these locations? Give me the town and where they are. Maybe proximity to Elvez, where I like to go too, but you know, where are they?
So we live in Center City, so we're pretty close to Elvez. But we have 1 office in Abbington, which is about 40 minutes outside the city, 1 in Upper Darby, 1 in Levittown, and then 1 in Northeast Philly, right on Grant Avenue and Academy Road.
Awesome. So you guys are a group, a little bit like my brother and I. We have two locations, but a lot of practices stuff into them. And one of our awesome associates is moving across the country to follow his amazing wife, leaving a space open. So there's a lot of musical chairs out there. So you guys are looking for a full-time or part-time associate?
Both, with the intent to go full-time if someone starts as part-time.
Okay, cool. So now I'll go through the questions. Why are you looking for an associate in this Abbington practice? What is the why?
Sure, I'll let Dr. Beckerman kick that off.
Absolutely. So right now the Abbington office is open 4 days a week.
Gotcha.
And we would love to, and we're growing fast. We have the patient volume and we have a lot of patients wanting to get appointments. I'm limited with my time, and the only time to expend it is by opening more days.
You can't clone yourself. That just clone yourself and do dentistry multiple.
I wish. If I can have 20 of myself, I'll be in a great position right now.
My wife says that a lot frequently. She like 20 of me, but there's only 1. But what I share with you, and to use Elvez as an example, and this is where I deliver value while we're doing this, is that Steven Starr is one of my idols. He has multiple restaurants. He can only run these restaurants if he has chefs. Without chefs, he can't run them. So the dentisting chef issue is becoming a good opportunity as practices like this grow to take over being an assistant chef, to learning from somebody who might not be on site. So you're growing this practice there. Now, we have a lot of people watching in the chat in Philadelphia, New York, DC, San Francisco are popular areas. So this is a popular area to be. How about the what? What procedures is this dentist going to do in this Abbington practice most of the time?
So I'm going to have you take over.
Sure. So most of the procedures, which is I would like to call our bread and butter of our dentistry, is going to be surgical extractions, molar endos, implant restorations, crowns, and placement as well. We place a lot of implants. So we're not going to focus on diagnostics. We're not going to focus on exams or hygiene at the most, but that's going to be your bread and butter as a dentist. So if you're
now, what if someone's applying who doesn't know how to place implants? Is there an opportunity to learn that?
Absolutely.
Or do they need to come with that skill?
No. So we don't expect anyone to come with any of that knowledge. We expect all of our candidates or incoming associates to come with a clean slate. And if they have some sort of desire to focus on these things or be a super generalist, which is what we call ourselves, then we have the mentoring and the manpower and the patient base and the time really to give them those skill set that they want to gain.
And awesome. If I can jump in, Doc. We've done it before, actually in our office. I have another partner who's a dentist as well. And between the 2 of us, we share over 15 years of dental experience. Both me and my partner provide a wide range of dental services, and we sort of build our office as a one-stop shop to all your dental needs.
And one of the things I'll share, I want to say, because I have a similar practice model, is, you know, when you work with practitioners in multiple practices, you have this like friend in your phone, meaning my associates can text me midday, whether I'm working or not, and saying, Mrs. Smith is crying because her crown costs blah, blah. I say, okay, tell her we'll give her $100 off, or the assistant and blah, blah. So there's really value when you connect with a seasoned owner at all times. I have a favor I could ask you guys though, okay? You look like Dr. Beckman. Do you ever go to the gym? You look like someone who does go to the gym. Do you go ever? You look like one of those guys, right?
I do.
So when was the last time you freely eaten bread and butter? I'm going to guess it was like 5 years ago, right? Do you eat a lot of bread and butter? I'm assuming the answer is no, right?
Mm.
Yeah. So can we stop calling it bread and butter dentistry? That is not what people eat anymore. Kale and quinoa dentistry. People say that. Eat bread and butter. What is this, a wedding? Is this my cheat day? No one needs bread and butter. So I'd like you to change that to kale and quinoa dentistry. But what they've shared is really important. Of these are the core procedures you'll do as a general dentist, but the opportunity to grow. So how can people, if they're watching in right now on a recording, they just popped in and said, we got Abbington, PA, close to Center City, Philadelphia, a group practice, part-time to full-time associate. Someone says, that's something that I want. How can they reach out to the two of you directly?
Sure. So I'm going to give everyone my phone number right now. I'm always available to anyone. It's 407-463-0565. You can shoot me a text there, and I'm going to write out our email. It's a little long, and I don't want anyone to misspell it, so I'll write it out in the chat.
Perfect.
So everyone who wants to reach out can shoot an email there as well.
And I do it also on your website, so
Yes.
they can find us there.
Exactly.
And anyone can text this number now or in the future. It's our text line, say Abbington Job. But I also, before you guys jump off, on April 22nd, so I'm returning to in-person events, which I love. We're having a meet and greet in Center City, Philadelphia at the Cambria, which is, I live at 13th and Spruce. And it's going to be an opportunity for you to come and meet people. So join us for that. You can text networking to 215-543-6454. But make sure both of you guys come, because we're going to have people looking for jobs, key resources, and sponsor. What I encourage you to do is to look for in-person networking events. If I wasn't hosting this during a pandemic, there probably would be them all over the country. But I believe the world's going to start to open up, and magic happens when you go to an in-person networking event. You talk to someone who doesn't need an associate, but they say, oh, my dental school friend definitely needs someone because his associate just went to Perio. So hope to see you guys there.
Absolutely.
Thanks so much for joining us. Hang around, share in the chat. So glad to meet you guys virtually, and hope to meet you guys in person on April 22nd.
Likewise.
Awesome job, guys. So that's an example of what we do. Showcase jobs on our platform and then bring them to life, BTL them through things like this. So that was a job in Abbington, PA.